projects that you stepped forward to be part of. Some more rewarding than others. I would say that the projects I've been especially appreciative of have had to do with parking. Behind the scenes planning and thinking. It was hard, it wasn't easy, but again, you said, yes, I'll come to the party. My first memory of you was when a group of us came over from West Ross Park Mental Health Center when we merged, and I think that was in '89. And I remember being in 74 Penwood Road and walking down the corridor, and you and Sandra were both sitting in, I think, your office on the first floor. And I was sort of chatting it up and saying, okay, new colleagues, I'll just sort of try to make my mark. And then I walked, I'd say goodbye, and then I heard the two of you going, shh, shh, shh. And I've always wanted to know what you were saying. I'm sure you don't remember it at all. I remember it, but what I took from that is, here's two people I definitely want to get to know and work well with. But anyway, over time, it's proven to be very positive. You will get great. Thank you. And I think it'd be great maybe for some of us to hear a little bit more about what you plan to do, if I'm not mistaken, at VinFed beyond this. Because you're not losing. Our clients are not entirely losing you, if I'm not mistaken.
Well, I'd like to say a few words. When I heard that you were retiring, I was trying to remember what it was like when I worked here before you were here. And then I remembered you've always been here. And when I was a resident, I remember there was this very dangerous, tall, schizophrenic patient who wanted to date a redhead in the clinic. And he would also drop off his knife in Southern Clinic, and I found out the redhead was someone named Kathleen Puckett. And that the psychiatrist had to very carefully engineer an answer for this patient that she was married and taken. So, so we've worked together for a long time. It's been over 15 years, and I looked through our caseload, and we still have, till your departure at this point, we still have 12 patients together that we have worked together for this length of time. And when I first started here, I would wonder what you did with your patients because they seemed so satisfied after they came away from seeing you. And I would sometimes bring it up to the team, what's going on with your patients? And I think you thought I was being scrutinizing, but I was just curious. And I guess through the years I've realized that you're an extremely caring therapist, and that what a patient is thinking and feeling is very important. And you've made every patient feel special. At Mass Mental Health Center, which is, I have to say, an institution with a lot of institutionalized patients that have made it to the outside community. You have been very special to them, and you've also been special to a very large number of coworkers here, which can be a hard thing to do because it is a stressful place to work. So, although we're very busy, but you've made a lot of us feel very special. You've had the highest professional ethics in working with us. You've never taken a low blow at anyone. You've always carried yourself as a model, and it's been my pleasure to work with you because I think you've brought out some of my best work here. And I want to wish you the best of luck.
I worked with Kathleen for, I think, 20 years. I don't remember who came first to Mass Mental. It was Kathleen or myself. And we've had a wonderful working relationship, friendship. And I just want to reiterate what Rob said about being genuine and authentic with your clients and with everybody. But I think with the clients, that's a real gift that we don't always see. in clinicians, and you just have that gift, which I've seen it over and over in your work here. The other thing that I use Kathleen a lot as sort of a peer person to bounce things off of when I had a question about something, and that she always had a very good, authentic, down-to-earth, very manageable resolution to whatever was going on, and I really appreciated that. But most of all, I appreciate our friendship and want to wish you the very best going forward, Kathleen.
I wanted to thank Kathleen as a fellow nurse. I had spoken to her before, but having real good models of nurses and holistic care, something you represented for me. And if there was ever an emergency that I always usually went to, if you were there, I had this sort of reassuring sense that another very practical person was there to sort of keep another pair of eyes on the situation, to be an assistance, and always reassuring. You've been inspiring to me as a nurse leader here. Very grateful to have, and you've been here, you were here when I came. Like many of us, like, oh my gosh, it's going to be different without you. And wish you lots of luck.
So I'm probably one of the people that has known you the least, you know, according to everybody who's been here with you for 30 years, but the 15 years that I have been here, I've always felt like you are a mentor to me, and that you transfer to me all of those qualities that that make me want to be a better clinician every day. And you know, those of you who didn't have the pleasure of being supervised by Kathleen will know that she also is a very multi-purpose. Because she, you know, when I had boyfriend problems, she was there. When I was pregnant, she was there. You know, whenever I had a disagreement with anyone, she was there. And whenever I was complaining about something petty that I really want to do, she would just put her straight face and say, "Rosa, you just need to do it. Cut the crap and do it." And I was like, oh, I'm in trouble now. But I always could count on that neutrality that you had in listening to anything. It doesn't matter what it was. You never felt, you know, like, you know, that I was being offensive or too loud or too inappropriate. You know, you always sort of helped me feel balanced and even corrected my English pronunciation. So I'm very appreciative of, you know, everything you've given to me, and I hope that we don't lose contact. So thank you, Kathleen.
I'd just like to say, personally, it's been great working with you, Kathleen. Having worked in the residential program since the late 80s, early 90s, you know, I've seen a lot of managers come and go, and everybody's always had rave reviews working with Kathleen Puckett. I think having worked at the Quarterway House, Fenwood Road Residence, formerly known as Quarterway, back in the day, I think you did. It gave you a unique perspective on some of the issues that residential staff deal with, and you've always been collaborative, thoughtful, and really good to work with, and look forward to continuing that on your part-time basis.